But it boils down to beginning in the late 80s, early 90s, the U.S. started noticing a gap in life expectancy and mortality compared to our other westernized countries in the world that for whatever reason we weren't keeping up. And as we started getting more savvy with this data, we not only found that we were not living as long, but our quality of life and the health indices that measure the health of a country were also falling, despite the fact that we spend sometimes twice, 3 times, 4 times as many dollars per capita on healthcare relative to other Western countries. And that gap got so big that in the last about 5 years, there's been a cry for major reform. In politics, as you know, healthcare reform has been going on for decades, but we now have hard and fast science saying that what we're doing isn't working and it really needs to change. The data that came out of that showed a couple of major points. The first one being is the thing called the social determinants of health. One of the things that as healthcare providers, so when you think of healthcare systems and clinics and hospitals and things that have traditionally defined health based on its pathogenic model, which is disease-based, right? That it's built to deliver rescue care. It's built to deliver trauma care and emergent care and things like that. And as a result of that, we've let go of the social aspects of health. And so when we did the study on the social determinants of health that came out in early 2000s, it showed that as healthcare providers and healthcare systems, we only have about 10% of people's health. So it's, well, gosh, what made up the other 90%? A very small part is genetics. The largest part consists of your behaviors and who and where you choose to live. And so, kind of your environment, the people you surround yourself by, and those type of things. So, nearly 80 to 90% of your health is about your lifestyle choices and how you live your life. And so we started looking at that and saying, okay, as a system, as a political and governmental system, then how do we shift this paradigm? And some of the data points that came out were 2. One, when you look at gross domestic product and how GDP relates to healthcare spending, there's not a direct correlation. And the work that has been done has shown where the money correlation is relative to health outcomes is in a thing called income inequality. The United States has the biggest gap between the haves and the have-nots. We make that gap the worse, even further, worsening it by what they call the American healthcare paradox. Elizabeth Bradley did this work, and she showed that for every healthcare dollar spent in other westernized countries, there's a group called OECD that kind of does all those metrics, showed that most countries spend $2 for social services, that's the other social determinants of health. The American healthcare paradox is that we spend for every $1, only 55 cents on those other services. So not only do we have the biggest gap that's associated with poor outcomes in health and income inequality, but we make that gap even worse by not investing in the social aspects of our society.